Good afternoon, because you're going to watch this in the afternoon. It's morning for me right now, but good afternoon. My name's Olivia. I'm known as Olivia K on Facebook, Ollie K on Instagram, and WarmEM 9800. I cover nursing-related topics that's going to help you for your next attempt for your NClex or your first attempt, and even nursing school. So stuff that will help you while you're in your nursing journey and whatnot. I have a playlist for fundamentals, which I'm going to update a video too. I think next month I'm going to do that around September-ish. I'm almost done with the maternity playlist, so I'm just going to spruce a video 2 up. Why not? And then I have a playlist for pharmacology, the med surge, comparing and contrasting two different disease processes or more, which will likely be covered, like if you're doing NGN style question, like the case studies, or like trying to compare and contrast. So you will find those in your Q banks and nclex, so it's likely there. And then I am currently developing a maternity playlist, so I have one out now. I'm gonna probably close it soon. So there's like this, because this video is going to be a 2-parter actually. So I'm going to do the second part after this, like talk about the postpartum complications, the stages of labor. So that's going to be part 2. So this one's going to be fetal arrhythmias and stuff to be aware of. And then if you're trying to get to nursing school, I do have a playlist of the TEAS videos, but I didn't make those personally. That's from years ago. So this material should still be helpful, and if you're trying to get into nursing school, trying to take the HESI or TEAS, so it should be very helpful for you. Now, you get bored of my nursing related topics. I go over reality TV shows. I'm going to go over the recent Ultimatum season 4. I have a lot to say with that one because it's still fresh in my mind, and I just finished watching it like 2 weeks ago, less than that. So I have a lot to say about that one, and I have a whole playlist with that one. I have a playlist with the Love is Blind. I know that's the Love is Blind UK is coming up. I've never watched the Love is Blind UK series, but if you like the US version, the one we've been watching, I do have playlists from 1 to 10. I'm not going to watch it again. Then I have other reality TV reactions. So you do want me to watch a reality TV show and react to it, just let me know. You can hit me up in my handles that you see in the description. Now, you get bored that I do cover documentaries and also some movies. So suggest a movie I can watch and I'll react to it. That's fine. No worries on that. And then I do go over like opinion pieces and stuff. But today, this is going to be part 1 of what I'm going to cover for these 2 videos. So I'm going to do another one in a bit, and I'll reserve it for the week after. But this one's going to be talking about the arrhythmias for the fetus rather, and to be aware, because this is very highly tested on the NClex, and you will see this in your Q banks. And a lot of people had some issues with the fetal arrhythmias. I know I did when I was in nursing school. So I like to cover that as much as I can, and then hopefully be helpful about it. So with that said, very important you pay attention to this lecture, especially because there are interventions you need to be aware of. So before I dive right in, there's 3 words I want you to recognize when I'm talking about this and keep in mind, because this is going to be important for the interventions. Veal shop. I'm sure you guys have already heard that, whoever's taking maternity, newborn now. Again, I'm going to say this. Veal chop. So VEALE. So like the meat, right? Chop. Like pork chop. Chop, chop, chop. CHOP. One more that you need to be aware of. Lion. LION. Like the animal lion, raw lion. Pay attention to that. LION. Okay? Let me begin. So the fetal heart rate, this is very important for you to understand, because this is going to be your baseline for the fetus inside. It has to be 110 to 160 beats per minute. They're going to have like a strip where they have the mom's normal arrhythmia, like rhythm sinus. So you'll see that. Then you'll see the babies. So which you'll like, I don't have a graph right now at the moment as I'm talking, but I will post it into the information in the description after. You'll see the different types of arrhythmias that you will see comparing to moms. So that's going to give you a good idea, okay? Now, here are the different types of arrhythmias you should be aware of, okay? Sorry, too many messages getting to me right now. So there's fetal tachycardia. So I mentioned the normal heart rate is 110 to 160. So this will be over 160. So the baby has to be on some sort of distress. So the baseline would be greater than 160 beats per minute rather, for at least 10 minutes. So it could be that the mom has a fever, an infection brewing in her. The mom's dehydrated. Remember, when you're also dehydrated, your heart rate's like, high, because it's trying to compensate. So the baby's going to try to compensate too. The baby could be going through hypoxia. The mom could be having hyperthyroidism. And you know, with hyperthyroidism, your vitals all over the place, your labs all over the place. So electrolyte imbalances is all over, and that will cause the arrhythmia, okay? Then you'll have the medications that could cause it. Remember, we talked about turboline the last video. So again, think about when you're on a plane, there's turbulence, and then it's trying to calm it down. So it can also cause that too, and then fetal anemia. So the interventions you will have to do for this, you're going to assess the mom's vitals and temp, and we'll have to do what's called the lion. So remember how we talked about, I think a few months ago, we were talking about positions. Lion, I just said a second ago, the lion. So the mom will be positioned on the left, so laterally, right? Lion, right? So left side, IV, oxygen, notify the provider as needed, right? So in this case, it would be needed. So you need to let the obstetrician or the provider be aware. Treat the underlying cause, because it could be, like I said, an infection fall. We know could be hypoxia. The mom could be pre-dehydrated, so hence why we have the IV. Okay. Then we have fetal bradycardia. So which would be, again, normal heart rate for the fetus, right? That's 110 to 160, less than 110 for at least 10 minutes. So here's the possible cause: umbilical cord compress prolapse. So we will get into that next video. I cannot speak for some reason. Sorry about that. Maternal hypotension. The blood pressure is less than 110, or less than. So then you have uterine tachycystole. I'm a nurse and I can't pronounce half these words. What's wrong with me? Uterine rupture, which we'll talk about next. Prolonged fetal hypoxia, and some of the maternal medications. So again, lion. In this case, you need to stop the oxytocin. Remember, oxytocin is what helps progress labor, right? So we're going to have to stop that. Lion, on this case, reposition to the left. You don't want it to be on her back. Why? Because the blood pressure will tank even lower, and then it's more harm to the fetus. Increase IV foods as prescribed. So again, lion, assess the blood pressure. Perform vaginal examination. So if there's a cord prolapse, right, or rapid fetal descent. So we're going to cover the labor complications in part 2. And then, of course, you want to notify the obstetric team, the provider, okay? Then, like what I was talking about, veal chop, okay? And then lion. So I'm going to talk about veal chop real quickly. So you have the variable, you have early acceleration and late variable. So which is, again, we're talking about the baby's arrhythmias. So if it's variable, you need to do, again, what I was talking about, lion. So lion, you lay the mom on the left side, not on her back, not on the right. It needs to be on the left. So you increase IV to keep her hydrated. You want to give her the oxygen to keep her comfortable, and then again, don't invite a provider. So cats could also indicate cord compression as well. So when that's happening, you need to let the obstetric team know right now. Okay. Then there's early variable. So that's head pressure, which is you want to continue to monitor it, but no interventions needed unless there's more of a complication that's occurring. Then you have the acceleration variable, which is okay. There's no intervention really needed. You just monitor it really. Now there's late variable. So again, this has to do with the placenta, cord prolapse, X, Y, and Z. Lion, same thing I just said like a few minutes ago. Left side, IV, push IV fluids, oxygen, and notify the provider. Okay, so you remember lion, veal chop, you are good to go. Okay, so when you have the blood pressure, and you have to pay attention to the arrhythmias with the fetus, and then you have to pay attention to mom's vitals depending on how the outlook is. Sorry, I just ate something. You do lion, okay, or you keep the mom comfortable, or you reposition depending on where we're at. So of course, early head compression, you just monitor. Acceleration, there's nothing going on really, just monitor. That's all you do. All right, well, this is part 1. Get ready for part 2.